My name is Brittany Smith. I'm a licensed clinical social worker, and I work in the role of a family intake therapist at Cook Children's. I have been in this role for about 2 years, so I came in mid-pandemic, which was really fun and interesting. So have really got to see kind of the peak of the pandemic and how that affected the emergency department behavioral health side, and then now kind of following the pandemic and what we've seen in the increases in behavioral health problems with kids. So as a family intake therapist, I work primarily in our Fort Worth Medical Center's emergency department and am assessing level of care as far as acuity goes with kids who come in crisis. So we're looking for whether or not the child is safe to discharge home or they need a higher level of care. So we see kids who come in 24/7, 365, and are needing kind of an emergency mental health evaluation. And so initially they'll go through triage, they'll see a medical physician, get medically cleared, and then see one of our therapists. We'll do an assessment, staff with one of our on-call psychiatrists, and make a recommendation from there, which is an outpatient care, a partial hospital program, or an inpatient hospitalization. So some of the challenges I face when talking to families are really the view of the crisis that their child and their family are in. Crisis is subjective, and so whenever a child or family presents to the emergency department or on our emergency line, we ask questions and don't assume that crisis means what we think it means in the emergency department. Additional challenges that I see in my role are a lot of social needs, and kids come attached to families and families come attached to social problems. And so it's not just the person, but it's the person in their environment. And so we are really looking at what the child's environment is. So some of the ways that we encourage parents to help their kids is to help themselves and kind of examine their own mental health, whether or not they need to seek mental health treatment of their own. A lot of times if a child does go inpatient, we encourage the parent to seek help for themselves, whether that's support from a church, a community, a professional. It's really important for the parents and the guardians to receive the support they need in order to support their children.